Thank you for joining Hawaii Wellness Network. And I have a special guest tonight to talk about spine health and general health with bodies. Dr. Joe, thank you for coming on.
Hi, thanks for having me.
And you are from Upper Cervical.
Yes, yes.
It's a very interesting name. How did you
It
name
gets
your
confused.
business?
I have to make sure people are talking about the right end of the body. It's not cervix, it's cervical.
Yeah, well, yeah, we'll make that not a gynecologist. Yeah, that this
Exactly.
part of the body.
I get those questions a lot.
Okay, well, I'm glad that we straightened that out in the very beginning
Yeah,
to make
yeah.
my face turn red. A little bit. So, a lot of people have a conception or what they think is a chiropractor.
Mhm.
And if I get in a car accident and my back hurts, I come to you, and they
Mhm.
don't think about preventative. And do you want to give some tips to people? Like when
Well-
you first meet people to kind of keep up with your body and not wait until you're having this horrible pain and you can't move.
Yeah, well, first of all, I am a chiropractor. I'm a licensed chiropractor, but what I do is extremely different. First of all, I don't do any twisting, cracking, popping. I make a very precise correction to the top of the spine, which I don't know if you can see back here, but the top of the spine is right around the brainstem area. And it's a very precise correction, very gentle, but very, very specific. And it's important because that area not only is the center for communication between the brain and all the functions in the body, but also your posture is all controlled right there. So when we have a distortion in posture, so when you're talking about low back, generally when my patients first come in, they have a pelvis that's tilted up on one side, a leg that's pulling up on one side, and that's because they have interference in the nerves that are controlling all of their posture in their body. So as soon as we open that area up, take pressure off of that area, the hips level out, the legs level out. So it can affect low back in that area.
So they should come to you. Like, I stand on one side of, sometimes when I'm standing, I notice that I lean over or I put one leg up.
Mhm.
So when you start seeing like imbalances like that before you're having pain, it's smart to come in and, get everything adjusted and go
Sure,
back to.
sure. Although, yeah, I mean, most definitely. But typically, the way that we are programmed is that most people wait until the last minute. So I'm hurting, and so now I go in. So that's usually how I get my influx of people in the beginning.
And we're here to encourage people not to do that.
Yeah.
Because then it's like, okay, I'm 90% in pain, fix me.
Yeah.
But when they're a little bit off balance, it's easier for you to maybe do some adjustments and keep it up than.
Well, either
to-
way,
yeah.
I mean, you always have to start somewhere. So, as soon as we put my patients in balance, and then we continue keeping them in balance, and the more that their body's in balance against gravity, the more that the body heals.
Right.
So, yeah.
Right. And so if if you're in balance, then you do get in a car accident or you do have a little fall, your body is going to actually have better, muscle control.
Oh, most definitely.
And you won't be as hurt
And
damaged.
for athletes, for anybody which we all, anybody that utilizes their body to any extreme or any extent, balance is important. So if you're a runner, to run with one hip, that I had a guy that came in and he had a hip that was 1.5 inches off, and he's a marathon runner. Well, think about the constant damage you're doing to your body, even though if you're not feeling pain, but think about, off balance, the wear you're putting on your body
On one
versus
side.
balancing it to gravity. Yeah.
So it's just a matter of time when something major is
Oh,
gonna
most
happen.
definitely, most definitely. And that's with most of us, Most people, that's what I was saying, wait until they're out of balance. They're out of balance could have been a childhood injury, it could have been something that happened earlier in life, but we wait until there's a crisis and then wait to go get it figured out. So, yeah, the sooner you get balanced, the more that you're preventing down the road.
Right. And you have a unique way of testing. So if someone comes in and says, I want to get tested and just see where I'm at, I don't really notice any problems, but I just want to do preventative work. So they'd come in, and then can you explain your testing?
Sure, sure. So basically, like I said, if we have interference at the brainstem level, so basically what we're talking about in the spine is up at the top of the spine, right below the skull. And if you have interference there, it's going to throw your muscles into an imbalance. So you're going to have muscles pulling stronger on one side than the other. So I do a muscle testing, and basically it's like an EKG for the heart, because the heart beats, it's a muscle, so the more electric pulse that it gives off, the stronger that it is. Well, your body musculature all works the same way. So when it gives off an electric pulse, you can tell if it's stronger on one side than the other. So we can see imbalances up and down the spine in the musculature by what this test provides. And then I also do a thermographic test, which basically measures the temperature from side to side, which can tell if we have nerves regulating the blood flow on an even basis. Because if you do not have nerve interference, ultimately, then you should have equal temperature going up and down your body.
Wow, and you can't hide things under that.
Oh, exactly. So
Amazing.
they're great tests because people look at these and go, oh, that's exactly what's been going on with me, and they think I'm faking it, you know, and I've had people go into tears going, that's it, you know, so it's
Because they've
amazing.
been on, getting pain medication or things like that, and that's
And nobody
obviously-
knows how to fix it. Yeah,
Oh, great.
exactly.
And do you do X-rays, or so
I
the
do.
consultation would be the 2 tests, and then
No. The consultation's more than that. So I, obviously get a history on my patients, and then I explain a little more thoroughly about what it is that I do, and then I do the thermography, and it's called EMG. I do that, the SEMG, which is the muscle testing. I also do an electronic range of motion to see how well the head's moving on the spine. Then we do some laser light balance. So in other words, I'm checking to see if the shoulders are off, the hips are off, and then we do digital scales as far as the balance weight distribution. And through all of those things, then I can narrow it down if we have an issue here. And if it looks like that's the problem, then we go into X-ray, because like I said, I don't do anything random. I don't do anything guesswork. Everything is very precise, very scientific of what I do. I measure down to a 1/16 of a degree exactly how that bone is misaligned. So it's precise calculations that I make, and I do that by 3-dimensional X-ray, and all of that is included on my consultation.
and then you
initially.
do a plan, obviously.
Yeah, well, that
how
comes,
many times they come in.
Yeah, and that comes down the road is, first we get my patients adjusted for the first time and see how well the adjustment went, and then I do a post X-ray. So then I measure exactly in exactly the position, the same posture, and the only thing that would have moved is the atlas, the bone that we're adjusting. And so we measure to make sure that it went back in place exactly where it's supposed to go. After I've got that consultation or that confirmation, then I can make a better assessment of where we go from here.
So do a plan. And I would guess that if you're not in alignment, you might have other issues besides pain. I mean, and we always talk about the pain because that's the obvious connection with the chiropractor, but like dizziness or lightheadedness, I mean, if things aren't
Yeah,
even.
yeah.
Is there
Well,
other complaints that people come in and
I just happen to have this
Wow,
handy
great.
chart right here.
look at all those symptoms?
Well, the thing is that what we're talking about is the brainstem, and so this is where the brain communicates to every function in the body.
Wow.
So if we have some interference here, it can literally affect the function of anything. So I've got patients that come in that have allergies, that have high blood pressure, that have digestive issues, a number of things, because every organ function is controlled at the brainstem level.
Wow.
So if we have interference there, it can literally affect the function of anything.
And a
in the
lot of
body.
people, it's amazing to me when I talk to them about allergies, they think once I have an allergy, it's just that way for the rest of life.
Mm-hmm.
Like I have to avoid cats or outside. And they're not understanding it's your body telling you there's something wrong. And
Well,
it's better
an
to go
allergy
and correct
is an
it.
immune response. An allergy is a defunct immune response. And the immune system is controlled basically through the brain at the brainstem level. So if you have interference with the immune system, then you could have an outbreak of allergies.
Right.
Just like sinus issues, those type of things.
So if you're allergic to cats, you could actually probably help them so they could have cats.
Mhm.
Because they, a lot of people just assume that's it. For the rest of my life, I have to avoid that food or avoid that.
Yeah, and one of the bigger issues here in Hawaii, and not so much on this island as on the Big Island where I came from, but is the fog. And we have athletes, again, back to athletes, but runners that go out and then, when there's heavy fog days, they get all of this sinus reaction. And I have a lot of people that have improvement on their reaction to fog.
Because it doesn't affect some people and some people it does.
Mhm.
So
Some
it's
people
all-
it really affects.
Right, and they have to stay inside or they have
Yeah.
to wear a mask. And that's not a way to live. So it's better to see if you can correct the problem
Most
than
definitely.
just deal with it for the rest of your life.
Yeah, yeah.
Well, great. So, and it could affect your heart and lungs and just anything. Do you have any stories you want to share about some of your clients coming in that had some of these issues?
Just today before I left, I had a young boy, he's 12, and he started off playing football at a young age and has been, popped around in the head quite a few times, and now he's just got solid migraine. He's throwing up every day, and I just adjusted him, and this area also controls the blood flow to the brain. And so after he got off the table, he was so lightheaded, and you would think, okay, that's not a good thing, but actually, because now we're changing the blood flow to the brain, migraines are primarily caused by interruption of blood flow to the brain or inconsistencies. So you have an inconsistency in oxygenation to the brain, and that's what sends the body into a migraine. And so as soon as he got off the table, he had to go lay down for a little while. He was very dizzy, and he said that for the first time in I don't know how long, he started to feel some relief from the migraine.
That's I mean, at 12 years old, you wouldn't even think they would have migraines.
At 12, it's so sad. Can you imagine?
Yeah, no.
Coming home from school throwing up with migraines.
No.
My mom used to tell me when I was a kid, it's like, oh, you're too young to have a headache. But I mean, it's reality for some
But if
kids.
your body's off, and they're actually starting to realize, like the soccer kids, hitting the ball in the head. I mean, there's a lot of injuries coming up.
Yeah, I've got a lot of kids. I have a little girl that just came in today. She's 2.5 now, and
Wow.
she had severe vaccination reactions and eczema head to toe. And after her first and second correction, her body was almost clear, completely clear.
2.5.
Yeah.
You just don't even think the little guys would have these issues.
Oh yeah, yeah.
And a lot of times they think, oh, it's the formula or it's the food that they're eating when they're little.
Mm-hmm.
So it just could be their body's off balance.
Yeah, I had a lady in today, and some of these things come out that they don't really come in with some of these issues, or they don't present these issues when they come in because they think, well, this will never have anything to do with that.
Right.
I had a lady that, I've been seeing her now for 3 months, and she just told me, she's like, you know what, every time I get adjusted, my constipation's better.
And you're like,
She
well,
goes, I've had it since I was a kid.
and she never mentioned that was a problem before.
Never,
And some people don't even know that that's not normal.
Mhm.
They just, I've been having this for 5 years and that's just the way it is.
Yeah, yeah. But the other side of it is also the postural effect. One of my first patients was a lady that was in her 80s. And she had just kind of told me off the cuff that, well, my husband always walks like 2 steps behind me because he's embarrassed because he says I walk like an old lady. And so it was, again, about 3-4 months into care, and I was measuring her hips to see if she was level. And I just kind of noticed she was just standing there nice and tall. And I just made the comment, it's like, so have you noticed your husband, is he still walking behind you and everything else? And she just kind of thought, she's like, oh, I can't remember the last time he's done that. Just because at 80, her head is over her shoulder, she's standing up more straight because all of her body and all the musculature in her body is balancing, and her body is straightening out.
That's great. And you saved a marriage. They're more happy they can walk together and hold hands. Put that to your credit. So can you work with also babies? Because I'm sure
definitely.
just coming, the whole birthing process and getting their spine off balance.
Yeah, I have a couple that actually are good friends. And I adjusted their 12-day-old baby because their first child is autistic. And, I've been taking care of him now for about a year. And she had a lot of problems with the birth, and she's 40, over 40. And she had a lot of problems with the birth of the second child. And they were just really, really freaked out that,
yes.
Okay, something is going to go wrong with this child. I don't know if we can handle a second autistic child, And and they were having the digestive issues. The baby was throwing up all the time and all of this. And so now he's just healthy, normal, happy, and got an adjustment 12 days into his life. So.
But isn't that sad? I mean, like 40, 50 years ago, women didn't have to worry about having a second child and worrying about that happening. But with all the chemicals and the vaccinations and all the things that we're doing to our bodies, and being outside, the environment and food, and
so
it's good to get a good start. I wish I would have started way back when.
Yeah. Well, there's a lot of people, like I said, that wait until they are in acute or chronic pain, to the point where they're not functionable, and then they come in. And you know, they always think it's like, God, if I would have done this a long time ago, I could have prevented so many of these things. You know, but I mean, even at younger ages, I've got one of my patients is a girl that is 22 years old, and when she goes out and runs, she'll run about 2 miles, and the next day she's got chronic hip pain. Well, her hip was at 1.25 inches off.
That'll make
So
a huge difference.
yeah, so it's like you're running on a hill all the time. And as soon as we leveled that out, you know, she hasn't had an issue at all. Now her husband was in the military, and these guys get abused. So he's in the Navy. He's 6'3", and he's on a boat 6 months out of the year, 12 hours a day. He's sitting like this with this steel bar in his
Wow.
back. So he had all kinds of neurological issues, from digestion to shocking pain down his neck and things like that. And you know, he's doing great too. You know, they're both athletes, and you know, he's back on the road again. So
Great.
yeah.
Wonderful. So you have, somebody can call you and that you have packages to do the consultation and maybe, some of the treatments
Well,
are.
with you and with your wonderful magazine, basically I offer that first consultation is absolutely free.
Wow, that's great.
So if you come in, you'll get all of these exams. We'll be able to check you out, even do the initial X-rays, and all of that is with the wellness, the ad I got in the wellness magazine.
That's wonderful. And everybody should do that just to see, what starting point they're at.
Yeah. I mean, who wouldn't want to do these scans? These scans are really cool. They're very accurate, and like I said, I mean, most times people look at it and go, wow, that's exactly what's going on, and it's very accurate. It's very
Wonderful.
It's neat.
So how did someone get in touch with you if they'd like to get some more information?
Well,
you have a website, I know.
I do have a website, and it is uppercervicalhawaii.com, and my phone number obviously 808-638-1313, and you can call up and say that you saw this through the Hawaii Wellness, or got the magazine, get the article out of the magazine, and come in for a free consultation.
Great. Well, thanks for coming on, and it's very fun. I'm actually sitting here, reposturing myself while I'm talking to you, thinking I need to get that done. And
Well, that's part of it too, is reprogramming your mind of habits that you're into.
sitting,
that, yeah.
And I'm like, I think I'm leaning to the right while we're talking. So, well, great. Well, thanks for sharing. I learned a lot tonight.
Yeah, thanks for having
Okay.
me. All right.
Well, we'll see you next week. Thanks.